Hi everyone, this is Dr.RUkmani Choudhary and you're watching Everyday Health SL. My today's topic is osteoporosis. Osteo means bone and porosis means porous. So this is a condition in which your bones are, porous and they are fragile, they are very weak, they have less density. Common condition. So let's talk about the risk factors who have this problem, the alarming sign. So risk factors, this is usually seen among female and they are, over 50. So age criteria is, above 50 years, there are more chances to have these, porous bone, and female and usually postmenopausal female. Bones are, they are very fragile, having less density and very tend to get fracture. Yes, it runs in family. There are some biological connections. This is seen among family, so you have more chance if anyone had osteoporosis in your family. If you are naturally thin, you have built naturally, you are thin, so yes, your bone are weak. And certain endocrine disorders, these are like thyroid disorders, there can be parathyroid disorders, and sometimes celiac disease in which your absorption gets affected, so you have less calcium absorption and you have weak bone, porous bone. Immune disorders, autoimmune disorders, you have rheumatoid arthritis or arthritis, porous bone, weak bone, cancer like multiple myeloma, in which again you have porous bone, weak bone, or there is osteoporosis. Some medicines, high blood pressure, certain diuretics that again may cause osteoporosis. Corticosteroids, medicines that are used to treat swelling or inflammation may cause weakness in your bone, osteoporosis. And yes, proton pump inhibitors, or we can say antacids, again they interfere with absorption of calcium, so they may cause weakness in your bone, eventually osteoporosis. Dietary deficiencies, if you have vitamin D, they are deficient, or calcium deficiency, so you may have osteoporosis. So these are certain risk factors, not definitive cause, these are risk factors. The symptoms in osteoporosis, if you have this condition, what symptom you may have? There is no single symptom and no direct symptom that you may have some headache or stomach ache. No, these are not like that. This is only diagnosed when your bones are break. So the symptom is only breaking of bone, fracture. You get your bone fractured easily. You are not supposed to. Even minor injury or a small fall, your bone, they are fractured. So this is the only symptom, and there are alarming symptom you may have. If you have, there is curvature of spine. Why? Because your vertebrae, they are, less dense, so they have porous, they are hollow, so there can be compression and you have curvature in your spine. And due to that, even you may have shortness in your height. Again, there is a curvature, compression of vertebral column, vertebrae, and you may have shortness in your height. And due to that, even you may have shortness of breathing difficulties. Why? Again, your vertebrae, they are compressing your chest. These are certain alarming sign. Diagnostic criteria, how we diagnose this condition, test required. So diagnosis is only made through X-ray, or nowadays this is called like DEXA. This is like a bone scan, bone density is checked. And sometimes there can be certain blood tests, like if there any symptom related with your thyroid or parathyroid gland, or you are having deficiencies of vitamin D or calcium deficiency, so sometimes blood tests can be done, ruling out of other medical problem. Now the management or treatment part, so combined, and the management is the finding out the cause in your case and just correcting that. If you have low level of calcium or vitamin D, so yes, supplementation in your case, you're supposed to have supplement. Your lifestyle is sedentary, so you might have weak bone, so you are supposed to do some sort of exercise. Going for a walk helps you and makes your bone strong. Even your muscles and ligament, tendon, get support through certain kind of exercise. So yes, start having exercise, avoiding alcohol, tobacco, all these things. Now the homeopathic approach in osteoporosis. There are couple of medicine in homeopathy, but yes, this is like individual approach. And all the medicines links are given in description box below. You can buy medicine and you can start your treatment, but not all the medicine. Just focus on your symptom, what symptom you have, what is your case, whether you are having curvature of spine or whether you are having bone pain or any night aggravation. Homeopathy, your symptom matters. So I'm starting with the cause. So calcarea first is the choice of remedy when you have weak bone, and in calcarea first there is a curvature and to the left side, so your spine is curved to the left side. So this improves your bone strength. Have hip bone pain or spine pain, you can go with a smaller quantity, and this is the company color. You may have different form in pills or in liquid. So just take with the help of dropper. If it is in the liquid form, 1 or 2 drops 1 or 2 times before having your meal, and just use it regularly 2-3 weeks. Next is Silicea. Silicea, again a very effective remedy treating in osteoporosis. In Silicea you have bone tender pain, and you have fistula, pus formation surrounding tissue. So these are the keynote of Silicea. 1 or 2 drops, same 1 or 2 times before having your meal. Ruta is given when you have bone problem as well as you have surrounding tissue problem, like there is damage in your ligament, tendon, or in fiber tissue. You have bone damage, with that surrounding tissues are affected. So that Ruta heals your bone as well as damaged tissue. So Ruta, 1 or 2 drops, same 1 or 2 times before having your meal. Calcarea carb is given when you have long bone problem, like you're having problem in your spine, you're having problem in your thigh bone, femur. So if you have any problem in long bone, then we prescribe calcarea carb. Constitution is like they are obese, obesity, and over. Next is phosphorus. For different kind of pain, like given 1 or 2 drops, same 1 or 2 times before having your meal. And a stooping and curvature is also seen in the phosphorus. Symphytum is very popular, like cases of fracture. When there are fracture case, so we prescribe usually Symphytum. So Symphytum reunion your bone. Why? Because this stimulate the fibroblast cells functions. So this promote, so you better reunion of your bone. So in these kind of cases we use Symphytum. Marol is given when you have bone pain during night. So there is night aggravation, bone pain. Marol is the choice of remedy. This is in the tablet form, and this is given among children. These are the tablet pills form. So just take 1 or 2 tablets 1 or 2 times before having calcarea first. And hypericum is given when you have, there is a problem in your vertebrae and there are compression. So due to that your nerves are compressed, so you have nerve pain. So hypericum treats that nerve pain. 1 or 2 tablets 1 or 2 times. This is Dr.RUkmani R34 bone recalcifying drop. Any problem like weak bone, fragile bone, bone pain, so this has multiple medicine, and this is in the liquid form. So just take 5, 10, 15 drops in some lukewarm water 2 or 3 times in a day before having your meal. This video can give you some amount of help. If you find this video knowledgeable and informative, please like, share, and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much.